Welcome back to Gamology's Experts React. It's me, Dr. Jordan Wagner, Dr. ER. Today we're checking out the game Wolfenstein. Oh, I like the music. Whoa, blunt head trauma, smashing to the side. You know, the middle meningeal artery sits on the lateral aspect of our head, can cause epidural hematoma, but also obviously fractures to the skull. Whoa, groin shot, and then hit to the trachea, to the throat. You can cause spasming of the vocal cords and then swelling to the vocal cords as well, which can cause your airway to be compromised and cause hypoxia. Oh, just, gunshot wounds to the head, just destroy. Is this person actually in a wheelchair? Feels like they're very low. Oh my gosh. Taking out the Achilles tendon, both legs can't flex off of that. The blood is actually like splatter pain everywhere. It's a little excessive. And then getting an injury to the chest with that type of hatchet, God, I'm not going to go that far. Maybe it'll cause a soft tissue injury and injury to the chest wall, maybe a fracture to the sternum or to the ribs there. But is it going to cause a lot of damage thereafter? It causes blunt trauma to the heart underneath. And, it can cause something called an RNT phenomenon where you're actually almost causing a shock to the heart and causing an injury where you go into cardiac arrest, but that's rare. Oh, stab wound to basically to the right chest. Basically that's causing hemopneumothorax. What? A gunshot wound plus a sword or some knife taking out the arm? Come on. There's a lot of slicing. Now, obviously, if you're slicing and you're having arterial bleeding, there could be this, degree of bleeding. Like this one right here, getting right to the neck, chopping, you're going to hit the, internal carotid artery, and you're going to hit the jugular vein. But are you going to die instantaneously? No, you're going to bleed out. Same here. Lower back injury, puncture wound, intestinal injuries, and then right to the neck. You're going to get, major blood vessel injuries, and you're going to be laying in your own pool of blood for a little while. Interesting, hatchet to the back. If you actually have it sharpened up and enough trauma, could it actually hit the spinal cord and cause major issues? Maybe. Oh, blood trauma to the face, fracture bones. We actually see stuff called Lafort fractures to the face, and it has to do with the degree of how much fracture you have. Laceration to the arm, you see some bleeding. It was actually good that the character went to grab its own arm to stop the bleeding. And it's like rapid fire drama. Laceration to the upper part of your lower extremity, the potential of the blood vessels being a little bit closer there. If there's not a lot of subcutaneous tissue and muscle, you could definitely hit major blood vessels, so you got to be super careful and protect that area. A lot of neck traumas. They're protected everywhere except for neck. Get some neck protection in these games and real life. The pull out where all the blood goes flying, it should be a little bit. When you see all these blunt trauma injuries to the head, besides having the frontal injuries of the fractures, old school, could you hit the nose so hard it goes into your brain? Hey, maybe you can splinter some bones up in that direction. Unlikely, but then you get a whiplash injury. Could you actually get spinal cord injury potentially? Whoa. This game is definitely known for lacerations, hatchets, knives to the lateral aspects of the neck. Literally, so my trachea is here in the middle. The major blood vessels are literally sitting right next to it. So it's protected by a more rigid structure, but it's still available. If you're actually hitting more laterally, it's mostly actually muscle. Anterior trauma to the chest. You have a chest plate on. You can't get into the chest cavity that deep, that hard. You're causing more blunt trauma than you are a bloody mess, especially in that situation. Now, if you have a ton of blunt trauma, can the skin pop open? Yeah, it could, but not to the extent that we're seeing in this game. Sorry. Wow, cool. So I've done axe climbing in my past, and on one of the axes, they actually have like a pick at the back end. So I wonder if there's a sharp object on the end of that hatchet to be able to impale into somebody. So you're impaling into somebody's abdomen. Could it go very deep? Didn't look like it there. But in the epigastric area, you have your stomach, you got your pancreas behind there, you have part of your liver that could get hit, you have the spleen on the other side on the left here, and then you have other hollow organs like the intestines a little bit lower. Could it cause major trauma? I mean, if you get way into the back and you basically get into your aorta that's coming into the back, it's going to be painful as hell. It's going to suck, but you got a long time before you die if you get no treatment. Shoot him in the butt? Oh, no. So we had two different objects there. Again, soft tissue injuries. You're just lacerating the tissue, making the person feel horrible and maybe not want to get up and then maybe want to play dead, but they're not dead. Same again, impaled object to the abdomen would cause pain, uncomfortability, maybe fracture the rib if it's a little higher. The legs are gone. That guy must be super strong to be able to use a hatchet to then hack off a leg in one swipe move. No. This is the sharpest hatchet I've ever seen, using it to lacerate across. Now, if you lacerate across, I've seen these injuries before. If you just go right here, it's all soft tissue, but you got to get deep here to be able to hit major blood vessels. When I'm actually doing a central line, I'm going in a couple centimeters to be able to get it in there. So it doesn't just sit right superficially where it's super easy access. So you have a vein sitting here on the outside that maybe you'll have some bleeding from, but not major deep where it's like literally 1.5 centimeters in diameter. Whoa! Who hits back here, right? Who hits back there? I mean, I have a good latissimus dorsi from all the pull-ups that I do. So hopefully I have a lot of soft tissue that protects me in that area. But that's also part of all the attachments of your rotator cuff in the back here. You have teres minor, teres major, you have all these other structures. So it's all just take that. It's going to suck because it's going to be painful, but it's not going to kill you. You're just going to sit there and be like, I can't move my arm. So anterior chest wall, hatchet, act to the front with laceration. This one doesn't have a chest plate on, doesn't look like that. So could cause some lacerations, fractures of the ribs and the sternum. Has to be deep enough. It's so messed up. Hand injuries are so painful and our hands are so sensitive. So that hand is useless. And what we're positioning to have it just sitting in the back like that, just standing there all proper with my hands behind my back. But, obviously you're not protecting your back, and then you're getting a hatchet right to your back. Again, posterior aspects of the ribs can cause fractures, and the lung itself, unless it actually causes a puncture from the ribs or that you're able to lacerate the lung itself, you're more looking at contusions and trouble breathing if you're going to survive this injury over the next 24 to 48 hours. Oh, that was a better depiction. Because look, anterior is exposing and it's able to get to the front. So that's more likely that you're going to be able to hit those vital structures in the artery there. Oh, actually good depiction. So right here you have your brachial artery that sits here. So in the pediatric population, that's where we actually feel a pulse for. But I've actually seen people who've had lacerations to these injuries. Even before I was a doctor, I was a student just shadowing the emergency department. And you saw an individual who got sliced up and bleeding just everywhere. And it's like, well, just go proximal to it, hold pressure, and the bleeding stops. If you can't control the bleeding with direct pressure or proximal pressure, then use a tourniquet. But do that first, because if you do a tourniquet, then you're decreasing blood flow everywhere versus you really just need to solve the problem by pushing a finger right here. Okay, lesson for everybody. Oh, head trauma. This is guns easy. Oh, so this is a situation where this right arm is basically amputated off. That is where you would actually use a tourniquet because you have so many blood vessels that are bleeding that you can't actually do direct pressure to stop all of the bleeding. So that would be an indication to have a tourniquet plate. If the gunshot wounds don't kill you, the axe hatchet to the neck will do such thing. Ouch. Definitely could hit, ribs 11, 12 in that area, the floating ribs. Your lung may actually go that low if it's in an inhalation phase. Pretty good depiction anatomy where that arm just goes crazy flying off. Now, this video game is showing that the anatomy just gets destroyed in 2 seconds. It takes more effort to get through all of that tissue and bone unless you are like the mountain where you have an unbelievable amount of strength and you can just do these big moves. But it has to do with just strength and the heaviness of the object. So injury to the Achilles tendon, maybe the calcaneus. So the calcaneus is actually the medical term for your heel. If you take out the Achilles tendon, which is that ropey tendon on the back, you're not going to be able to flex off of the ground because you don't have any more connection of your soleus and your gastrocnemius, which are your calf muscles. So you won't be able to really walk. You can step on your heel and use it like a peg leg to be able to walk, and then you're having bleeding to that area. Now, if that's the case, a surgeon can reattach it together and you'll heal. You'll be in a boot and all that stuff. But if you have a fracture to the calcaneus, that's going to cause, blood destruction. You won't be able to peg leg it because it's so painful. And then if the calcaneus is destroyed, the attachment of the Achilles tendon is also probably compromised at that time as well, because that's where it attaches to. Bleeding, there are some major blood vessels that go down through the front and then actually on the medial aspect of your ankle. There's the anterior tibialis and dorsalis pedis. Those are the two major vessels that we feel for pulses in your feet. So you can actually have major bleeding if it ruptures through that area. But the feet, just like your hands, are highly specialized pieces of anatomy. If you're having an amputation of the upper part of the arm, there's only a single bone, right? So that will go down through the middle. That is your humerus. You'll have multiple different muscles, all different types of fibers, different directions there. And you're going to have some major bleeding on the inner aspect as well as the lateral aspect. What's really interesting is we always worry about the vessels that basically are underneath the bone here because they run with the nerve as well. So we worry about anybody who has a mid-shaft humeral fracture, the integrity of the major blood vessels and the nerves. So you're always checking the function of the hand. You actually want to make sure that somebody can flex because that has to do with this area. Well, takedown, left leg is shot. Okay, the laceration to that side. You incapacitate the person by injuring their legs. You can't get up and move and run away. And then right to the neck. Wow, something different. Very cool. In a set of different ways that you can actually, advance in the game and injure somebody. So if you have a high cervical fracture, the issue ends up being, are you rupturing the brainstem, which then would make somebody not be able to breathe or have cardiac contractility. So that's how somebody actually died. Oh my gosh, both arms get hatcheted off, but the one that makes sense because the hatchet head was slicing through the right arm and the left arm was like, I don't want to be missing the party either. I'm going to come up too. Bilateral upper extremity amputation. Very rare. I've seen bilateral lower extremity amputation, even just from car accidents. And man, it's so sad and awful because, if you're losing both limbs, then you have to, learn to walk again as long as you survive the injury. But major blood vessels are bleeding. So you have to resuscitate the individual first, meaning, hey, I need to stop all bleeding and give you blood back. So you actually perfuse everything else: brain, lungs, heart, kidneys, liver, all the big vital organs. Okay, so if somebody has the amount of strength to take off an arm with that instrument, could they go deep with the hatchet through the chest wall? Probably. But that's not the majority of us. Unlikely that we can actually take a hatchet and hack through somebody's chest wall. It's going to take multiple swings to actually get through, and that just doesn't happen. Oh, don't even use the hatchet. There you go. Punch to the throat. Again, spasming of the vocal cords, closer to the airway, can't breathe. Could also have swelling of the airway as well. Vaso, spasming of the muscles tight. So you get hypoxic, you can't breathe. But if you just calm down, if I stop breathing right this second, I have about 7 to 8 minutes worth of oxygen from 100% on room air to about 90. Then I exponentially will decrease from there and I'm in a lot of trouble. But I do have a little bit of time. Literally, when I go to intubate somebody at the hospital, we hyper-oxygenate or pre-oxygenate somebody, and we actually call it denitrogenate. An individual has to do with gases. And then I have time to stick my, laryngoscope in somebody's upper airway, and I have a moment. The oxygen saturation's on the monitor. I can see it, and the oxygen's not changing. The person's not breathing. But there is an adage, basically, if you take your time and do everything nice and smooth, then it's going to be faster than if you try to rush, and then you're fumbling around. It's actually going to take you a lot longer. So you just take your time, calm yourself, and typically it takes less than 10, 15 seconds anyway to do that procedure, which we do every day in the emergency department for intubation. Whoa, not a neck injury. That was a hatchet to the side of the head, hitting that middle meningeal artery, causing a skull fracture, and then damage to the brain itself. So that probably had more damage to the brain, causing the body to be in shock, maybe pass out for a second. And then you have to deal with the repercussions of, hey, is there more damage? Is there brain swelling? And then is there a lot of blood that's pulling in the brain, causing a significant amount of pressure that could then herniate across if there's no relief of that pressure. Oh my gosh, finally we see here that the amputation, we see blood squirting appropriately. Holy cow, as if you have your pulse. So every time your pulse and your heartbeat, it's going to squirt that way. It's not going to be like then the veins are going to kind of just a continuous flow out because they're a low pressure system. I can see it, and the oxygen's not changing. The person's not breathing. Took out the leg, and again, anterior laceration to the neck. It needs to get lateral, which it looks like it actually ended up. Come on. What a move. That was probably one of the cooler takedowns I've seen in a video game. You guys all know one of my statements is don't pull it out. I don't think it would matter in that situation. The graphics are actually really cool. A lot of takedowns from the posterior aspect with incapacitating them by injuring the lower extremities, getting them down lower, and then boom, lacerations. If anybody's professional out there, is that a normal technique you would actually use? I'm assuming such, but do you actually get that close? Probably not. You know, talking to Cameron, Israel, I probably would say they probably want to be as far away from the assailant as possible so they don't risk injuring themselves. Medial aspect of the knee could hit some blood vessels that are coming down. So the major blood vessels actually go to the posterior aspect of the knee. You have your tendons of your hamstrings there. You can actually feel them. And then obviously the ligamentous attachment to the knee, the medial aspect, the medial collateral ligament attached to your medial meniscus. If it's that low, you can actually potentially hit the liver. If the liver is actually injured, then it could potentially take a lot of time for you to bleed out in the abdomen, and it may actually just be inside the capsule and solidify itself off. But you also run the risk of fractures of the rib as well as a right-sided hemopneumothorax or a combination of such. Whoa, that is a classic move, I think, like double combo. Hatchet laceration to the inner aspect of the lower extremity, then to the neck. Oh, so that looked more classic. Achilles tendon laceration and then major trauma to the spine and the back. So if you're able to get deep enough, your high spinal cord, transection is probably not compatible with life because it's interfering with your ability to breathe. And then you're going to basically asphyxiate, become hypoxic, and die. Ow. Ow. Those are just like soft tissue deep injuries that are just going to be awfully painful. When we get people that get these type of injuries, we try to wash them out as much as we can. But when there's deep puncture wounds, it has a high chance of getting infected, and you don't really want to close them up, meaning like suture them closed, because you're suturing in an infection, which you're almost guaranteeing somebody having an issue. So you end up maybe doing a few sutures so it's not a gaping wound, but you need the ability for it to like drain and clean itself out. A lot of times we don't give antibiotics for gunshot wounds. If it's a soft tissue flesh wound, a lot of times the trauma surgeon's like, nope, don't need to do it. And I think they correlated to the fact that it's such high speed temperatures that the likelihood of an infection is pretty low. Interesting. The technique to hold the arm, prevent the person from turning around quickly, and then wrap it all the way around in the neck. So interesting. So we don't actually see if it gets punctured into the head. I wonder, it would have been cool if they had the aspect of it hits the helmet and then it actually bounces off and slides to the side, and then you have to do it again. Very cool, good takedown. And then again, the injury to the head, does it actually cause massive injury versus just stunning the individual because the helmet's protecting a little bit, and does the blunted tip of the the hatchet actually go all the way through the soft tissue, or is it just blunt trauma? For more experts react, check out Gamology's YouTube and Facebook channel. And for me, if you want to see my reaction videos or some other educational content, check out Dr. ER on YouTube, Instagram, Facebook, all that. Appreciate it.